Morning. Today we'll be talking about double lumen tubes. It is a specialized endotracheal tube used in cardiac and thoracic surgeries where you require one lung ventilation. It has two parallel lumens which will allow separate ventilation of each lung. Indications for use of the double lumen tube. Coming to the absolute indications, preventing the damage and spread of infection or to the healthy lung, as in case of lung abscess and pulmonary hemorrhage. Secondly, to control the distribution of ventilation, as in case of bronchopleural or bronchopleural cutaneous fistula. Third, during trauma when there is bronchial tree disruption. Fourthly, in unilateral lung diseases like cyst or bulla. Then for surgical exposure in video-assisted thoracoscopy. And single lung lavage for the treatment of cystic fibrosis and pulmonary alveolar proteinosis. Relative indications are for deflation of one lung to provide a motionless field for surgery. Example, mediastinal surgery, esophageal surgery, thoracic aorta surgery, lobectomy and pneumonectomy. Coming to a brief anatomy of the respiratory tract, the trachea starts at the level of the cricoid cartilage and ends at the carina, which is the narrowest part. It has a length of 12 centimeters. It contains 18 to 22 C-shaped cartilaginous rings anteriorly, and posteriorly they are linked by superficial membranous wall and trachealis muscle. It bifurcates into right and left mainstem bronchi. The right mainstem bronchi lies in a more vertical plane. It is 1.9 centimeter length in males and 1.5 centimeter length in females, and it is wider than the left mainstem bronchi. The left mainstem bronchi lies at a more horizontal plane. It has a length of 4.9 centimeters in male and 4.4 centimeters in female. The left lung is 10% smaller than the right lung and comprises of two lobes, that is superior and inferior. The right lung has three lobes, superior, middle and inferior. Each lung has 10 bronchopulmonary segments supplied by segmental bronchus and artery for each segment. Hence, they can be resected separately without affecting the function of the other segments. Ventilation perfusion is best in the dependent parts because of the effect of gravitational forces on the lung compliance. By initiation of one lung ventilation, one lung will not get ventilated but it will be perfused. Hence, there will be an obligatory shunt created. There will be less shunt when the left lung is isolated, as left lung is smaller in size. Coming to the equipment of description, the double lumen tube has two endotracheal tubes which are bonded together to allow each tube to ventilate a specific lung. The double lumen tube can be left-sided or right-sided depending on the mainstem bronchus with its distal longer lumen designed to fit into the bronchial tree. The longer lumen is the bronchial lumen and it reaches the mainstem bronchus, while the shorter lumen is the tracheal lumen and it ends in the distal part of the trachea. It is made of polyvinyl chloride. It has color-coded cuffs and pilot balloons. The bronchial cuff is typically high-pressure, low-volume cuff and its pilot balloon is blue color. The tracheal cuff is a high-volume, low-pressure cuff and its pilot balloon is clear-colored. The double lumen tube package consists of a stillet, a connector and suction catheters. Some may provide an apparatus to provide CPAP to the non-ventilated lung. The cross-section of the double lumen tube shows a D shape. Sizes ranges from 26 French to 41 French. 26 French is usually used for children more than 8 years. Margin of safety is higher for the placement of the left-sided double lumen tube due to the longer length of the left mainstem bronchus. While inserting the right double lumen tube, it is a bit challenging as the right mainstem bronchus is shorter and the origin of the right upper lobe bronchus is just 1.5 to 2 centimeters from the carina. The right double lumen tube incorporates a modified slot on the endobronchial tube that allows ventilation of the right upper lobe. Placement of the right double lumen tube needs to be positioned to align in such a way that it is aligned to the takeoff of the right upper lobe bronchus. A CT, MRI and X-ray may help to locate the position of the right upper lobe bronchus. Indication for use of right double lumen tube. One is to avoid manipulation of the left bronchus, or if there is a left bronchus narrowing or anatomical variation. Then in cases of left pneumonectomy, left lung transplant, left mainstem bronchus stent, and in suspected disruption of the left tracheobronchial tree. Preparation and technique of insertion. When preparing the double lumen tube, both the tracheal and the bronchial cuffs should be inflated to check for leaks and symmetrical cuff inflation. Apply jelly to the stellate and pass it through the bronchial lumen, ensuring that the stellate does not protrude out of the bronchial lumen. The connector of the double lumen tube should be assembled on the ventilator circuit prior to intubation. A fiber optic bronchoscope should be available to confirm the position of the double lumen tube. This is the gold standard technique of confirmation. So how to identify the correct size of the tube? You have to see the height of the patient. For adult male less than 160 centimeters, we use 37 French tube. 160 to 170 centimeters, 39 French tube. More than 170 centimeters, 41 French tube.